an NHYA classification of heart failure. At which stage of heart failure should beta blockers be used and avoided? Which beta blockers should be selected in the management of heart failure, and principles in initiating treatment with beta blockers in the treatment of heart failure. As per the American College of Cardiology and American Heart Association guidelines, heart failure can be divided into 4 stages: stage A, B and C and D. Stage A includes the risk factors such as diabetes, hypertension, coronary artery disease or family history of cardiomyopathy. Stage B is asymptomatic left ventricular dysfunction. So there is valvular dysfunction or systolic dysfunction, but the patient is asymptomatic. Stage C is structural heart disease and the patient is symptomatic. The patient can be symptomatic with minimal exertion, or the patient can be symptomatic with moderate exertion. So there is structural heart disease and the symptoms include reduced exercise tolerance and shortness of breath. Stage D of heart failure is end-stage refractory heart failure, where the patient is symptomatic despite maximal medical therapy. The patient is symptomatic at rest, and this is end-stage heart failure when the medical therapy fails and the patient is symptomatic at rest with maximum medical therapy. Next is, at which stage of heart failure are beta blockers used? Now keep in mind that beta blockers, by inhibiting the sympathetic nervous system activation, reduce the structural changes in the heart and decrease the functional decline of the heart performance. Beta blockers are carefully used in stage B and C of heart failure. By decreasing the sympathetic activation, they reduce the ventricular remodeling, the cardiac workload decreases, and the functional decline and the progression of heart failure decreases. So beta blockers are used in stage B and C of heart failure, and they delay the progression of heart failure. Beta blockers are avoided in new onset heart failure because in the initial stages of heart failure, the compensatory mechanisms are beneficial and they help to maintain the cardiac output and perfusion to vital organs. Therefore, beta blockers are not necessary in new onset heart failure or in the initial stages of heart failure. Beta blockers are also avoided in end-stage heart failure or in acute decompensated heart failure. When the heart is in the failing stage, there is no further increase in the cardiac output, and administering beta blockers would further decrease the cardiac output, decrease the contractility, and will cause worsening of heart failure. Therefore, beta blockers are not used or they are avoided in new onset heart failure and acute decompensated heart failure or in end-stage heart failure with congestive symptoms when the blood is retained in the ventricle and the heart performance is declined. There is no further increase in the cardiac output. Beta blockers are avoided at these stages. Next is, which beta blockers would you select in the treatment of heart failure? Cardioselective beta blockers such as metoprolol succinate and bisoprolol is selected for the treatment of heart failure. They have selective action on beta-1 adrenergic receptors and are beneficial and are preferred. Carvedilol has an additional alpha-1 blocking property and antioxidant property. The antioxidant property of carvedilol is beneficial. It reduces the oxidative stress on the myocardium and is beneficial in heart failure. But the reported side effects of carvedilol is hypotension and dizziness because of alpha-1 blocking property. Next is, what are the principles of initiating treatment with beta blockers? Beta blockers are initiated at a very low dose, which is 1/8 of the target dose. The dose is gradually increased. It can be doubled every 4 weeks so that this allows time for the heart to adapt to a low adrenergic stimulation. So the principle of initiating treatment is start low and go slow. Start with a low dose and increase gradually over a period of time till a desired effect is attained. So thank you for watching. If you find my video useful, please like and subscribe to this channel.